Welcome to the Auditory Learner. This is going to be a quick study session of quizzes week 1 and 2 review. So let's hop right into it. So let's start with the week 1 check-in quiz. All right. So Aleve is a propionic acid. Aspirin is a salicylate. Advil is a propionic acid. Hydrocodone is an opioid agonist. Naltrexone is an opioid antagonist. Oxycodone is an opioid agonist. Silicic acid is a salicylate. And oxymorphone is an opioid agonist. Okay, next thing is match the description with its correct route of administration. So if it contains pellets enclosed with the shell to be taken by mouth, it's a capsule. If it's injection into the muscle, it's intramuscular. If it's compressed powder of the drug formed into a shape, it's a tablet. And if it's a drug formed into a candy, it's a lozenge. Match each drug with its correct schedule. LSD, Schedule 1. Barbiturates, Schedule 4. Nope, that was wrong. Barbiturates is Schedule 2. Diazepams, benzodiazepines is Schedule 4. All right, remember that. Testosterone, Schedule 3. Okay, so Schedule 1 is LSD, because we talked about it before, is Helms, which is heroin, ecstasy, LSD, marijuana. Barbiturates are Schedule 4. The tolls, testosterone Schedule 3, that was tax, testosterone, acetaminophen, codeine, ketamine, and benzodiazepines are Schedule 4. Okay. In what case may a brand name drug be indicated? The answer for that is when a patient is allergic to inactive ingredients in the generic version. Question 6. What is one issue with generic over-the-counter drugs? The answer is that they may be compounded with other over-the-counter drugs. All right. Question 7. What entity monitors controlled substances prescriptions to prevent trafficking? That's the DEA. All right. What phase of clinical trials involves studies of small samples, usually 50 or so, to determine if a drug is toxic to humans? That's going to be phase 1. Great. Translate the following prescription into everyday English. We got the 2 dotted lines with the 2 lines. Tab POQ4 6X5D. The answer for that is going to be 2 tabs by mouth of Tylenol 3 every 4 to 6 hours for 5 days. That's the 2 dotted T, 2 T's, tab PO by mouth, Q46 every 4 to 6 hours, X5D for 5 days. Great. Drugs that bind to enzymes and prevent them from working are known as enzyme inhibitors. Perfect. Inhibitors. Number 11, NSAIDs exert their effects by preventing formation of what pain molecule? That's going to be prostaglandins. Question 12, opioids exert their effects by binding to opioid blank on neurons on the CNS. That's receptors, binding to opioid receptors. Awesome, here we go here. Here's a question. If the AUCIV is 200 and the AUC oral is 50, what is the bioavailability for the drug? Well, if we remember this correctly, we divide AUC oral, which is 50, by 200. And then that's going to be 0.25. Okay. Moving on. Where's my fucking calculator? Right here. Perfect. Let's make sure. That's going to be 50 divided by 200 equals, that's correct. So that's bioavailability. You always divide 50 by 200. First 50, then the AUIV, whatever the AUCIV is. Sometimes it's 100, but this time it was 200 on this case. Question number 14. Imagine an IV drug with a half-life of 10 hours that is given to a patient every 10 hours. Doing so increases plasma concentration of the drug by 1 milligram per deciliter. Between what ranges will the steady state plasma of the concentration of the drug be? Express your answer in milligrams to deciliters. Now, the answer for this, because it's really quick, imagine an IV. If a drug is in IV form, it's going to start at 100. Okay? So that's your answer right there. Whatever it is, it says between what ranges is the steady state. Okay? So the steady state plasma is going to be the minimum concentration is 100. The maximum concentration is going to be twice that. So the answer is going to be 100 to 200 milligrams per deciliter. It's really that simple. I don't know why he complicates it that much, especially if it's telling you right there, IV drug. It starts right away. There is no absorption time. Okay. Next, what is the TI? What is the therapeutic index for the drug below? Here we have a graph with two drugs. One is a therapeutic, one is a toxic, and then we got two lines, one of them going to 8 for the therapeutic dose, and another one going between 64 and 128. So it looks like it's going in intervals of, so let's see, if it was 64, let's see, 64 equals 128. So half of 64 divided by 232. So 128 minus 32 equals 96. So see here, we had to do some math, right? So the toxic dose was 96, therapeutic dose was 8. So what do we do for TI? It's always LD divided by ED, just to make sure how that works. We're going to review this really, really fast. It's TD divided by ED. So whatever the therapeutic dose always goes first, and you divide that by whatever it's given, whether it's ED or LD. So TD always, you divide that first. So that's always input into the calculator first. So here it's going to be therapeutic and toxic, which is the lethal. But we're going to go therapeutic dose. So that's going to be 8. Let's see here, on 8 divided by 6. Oh, 96 divided by 8. Yeah, it's 96. So there was the toxic dose. It's TD. Yes, toxic dose, TD, not therapeutic. I mean, not ED. So it's TD divided by ED. Toxic dose divided by effective dose. There we go. Toxic dose divided by effective dose. Okay, so that answer was 12. Question number 16. A patient has been vomiting profusely. What effect would this have on excretion of acetylsalicylic acid? So if a patient has been vomiting profusely, what effect would this have on excretion? It would, yeah, well, okay, it would increase elimination. That was the correct answer. Great. Here comes the next question. Prodrugs metabolized by the liver are best given orally. That's going to be true. Okay. Which drug has the greatest potency? Now, this is very interesting because we have A, B, C, D of response lines on this little diagram here where I'm assuming the y-axis is time and the x-axis is dose. So, but we're talking about potency, and I thought that it was A because it was it reached the highest quicker, which was the second thing, but actually it was B because it reached a level of response that was plateaued quicker than anything else. So that was the correct answer. It's B. So it's not so potency is not always the highest thing on the graph, is what you want to take away from here. Potency is what reaches an effect and plateaus quicker, which is the greatest amount of effect at the fastest time. All right, so remember in your brain, Daniel, that it was the first line B, which is the lowest line, but it plateaued quicker. So it doesn't matter how high it goes. So the answer for greater potency is B. Here's another question. Liver converts fluoxetine to an inactive metabolite. What would concurrent fluconazole administration have? So this is a CYP cytochrome P450 enzyme table, and it's asking for if the liver converts fluoxetine to an inactive metabolite, what would fluconazole administration have? So then you look for fluoxetine, which is in the column of substrate and inhibitors. And so if the liver converts fluoxetine to an inactive metabolite, okay, fluconazole. So that's going to be CYP2C9. Fluconazole is an inhibitor. So if fluconazole is an inhibitor of the fluoxetine substrate, it would increase concentration, plasma concentration of fluoxetine. Interesting. So even though it's an inhibitor, it's an increase in plasma concentration. Got it. That's very clear to me. Question 20. Depression of the respiratory centers of the central nervous system caused by opioids would be best described as, we're going to say this is a toxic effect. All right. A toxic effect, not a side effect. Okay. And we need to understand what the difference between side effects and toxic effects are. And as we should remember, as I should remember, is that side effects, they act on non-target organs. Toxic effects act on target organs. Okay, so if we go back to this question, depression of the respiratory center caused by opioids. Well, depends on what the target organ is. Really, if you were to really ask me, depends on what the target organ is. However, if this comes on the test, we're going to do what he wants. This is going to be a toxic effect. Okay, so depression of respiratory centers of the central nervous system. Depression of the respiratory center of the central nervous system. Okay, so respiratory center of the central nervous system. So yeah, the opioid is an agonist of a neuron receptor. Okay, so yes, that would be a toxic effect. Okay, how about this? At a dose of 81 milligrams QD per day, what is the main effect of aspirin? The answer to that is antiplatelet. Number 22. NSAIDs are safe during pregnancy. The answer to that is false. If people are pregnant, if a woman is pregnant, she should not take NSAIDs. Okay. Here's another one. Um, Approximately how long does it take for antiplatelet effect to wear off? It's going to be 36 hours. It takes 36 hours for an antiplatelet effect of aspirin to wear off. So that's almost 3 days. 72 hours is 3 days. 24, 24. So that's about a day and a half right there, a day and a half for the antiplatelet effect to wear off. So if my mom is going to get dental work done, she should stop taking her aspirin for a day and a half so we don't stop 30 for 36 hours before the treatment so we don't have bleeding problems. NSAIDs interact with which of the following drugs? The answer to this is sulfonylurase. Sulfonylurase. Okay, NSAIDs interact with sulfonylurase. What is the common dosing schedule for Aleve? Aleve's dosing schedule is 8 to 12 hours. Okay, what is the maximum dosage of Tylenol per day in individuals who do not consume alcohol? So the maximum dosage of Tylenol per day in individuals who do not consume alcohol is 4 grams. How many alcoholic beverages can be consumed before any amount of Tylenol is contraindicated? The correct answer is 5. Okay, so how many alcoholic beverages can be consumed before any amount of Tylenol is contraindicated? We're going to say 5. He says 5. And just want to review that with my study guide here. So Tylenol is acetaminophen, right? How many out before Tylenol is contraindicated? So Tylenol is acetaminophen. All right. It says since it affects the liver. So here we go. 5 drinks or more, then no dose at all. I see. If 3 drinks, then less than 3 grams a day. So the question is, how many alcohol for time is so basically when something is contraindicated, that means you should not do it. Okay. So if they were to drink 3 drinks, yeah, they could still take it, but just shouldn't be more than 3 grams a day. But if they drink 5 drinks a day, that's a 100% contraindication. So 5 drinks is 100% contraindicated. Opioids are effective for treating fevers. That's a false. No, they're not. They are not. Opioids are not antipyretic. Which of these is a common side effect for opioids? That's going to be dysphoria. All right, dysphoria. Dysphoria is when there's a state of uneasiness or generalized dissatisfaction. Um, okay, to describe discomfort, distress, or uneasiness. Okay, so that is a common side effect of opioids. Okay, which of the following should be avoided with all opioids? The correct answer is even though should avoid others, probably many other things for pharmacology exam test purposes. When taking opioids, you want to avoid barbiturates. Okay, barbiturates, Schedule 2s. So, no barbiturates with opioids. What drug should be used for patients who develops hives in response to codeine and has severe pain? What drug should be used for patients who develop hives in response to codeine and have severe pain? The answer is going to be meperidine. Okay, meperidine, because that's what was in that diagram that we remember that says allergic reaction, hives, APAP, it was meperidine. Okay. Okay, so someone who hives to codeine with severe pain, meperidine. Which of the following is used to treat acute pain directly after surgery within the first 24 to 48 hours? Looks like the correct answer was again meperidine. Okay. Meperidine is used to treat acute short acting pain. All right. Which of the following? Well, you know what? I want to kind of go back to this. This is an opioid analgesic. So let's see here. That's non-opioid. Let's talk about opioid. Meperidine is a high-strength opiate. All right. So let's just make sure we understand um, anything that has to do with meperidine here. Okay. So not necessarily, but yes. So pyridine is should be used for acute pain directly after surgery within the first 24 to 48 hours. Which of the following has the longest half-life? Well, we know that's methadone. Which of these is particularly useful for neuropathic pain and analgesia? That's tapentadol. All right. Um, I got that one wrong. I got partial points on that. So here's a question. Charlie is a 49-year-old male dental patient of mine. He has come in for a routine dental cleaning, but you notice that as you're scaling, his gums become inflamed. After scaling, Charlie complains about pain and swelling. Charlie has suffered from gout, but is otherwise healthy. Oh my God, he just went over this yesterday. And Charlie's on anxiety meds. Okay. So, what analgesic would you recommend for Charlie? So, one thing that we have to make sure we understand here is pain and swelling. So he's in pain and he's swelling, which is inflammatory, and he has gout. Okay. Because there is inflammation, which is swelling, it's gonna have to be an NSAID. That's an answer, and it cannot be APAP because that's for analgesia and antipyretic. Charlie has suffered from gout. So what I put was I would recommend the patient take acetaminophen because I wouldn't want the other options to affect his gout. And then s- I put I honestly forgot the information regarding if anxiety medication are contributed with other NSAIDs and if there's any relation with gout. So the answer is anti-anxiety medications are often CNS depressants. So they interact with opioids. Also, other NSAIDs like ibuprofen would be a better choice here since they have anti-inflammatory effects. So if someone's taking anxiety medications, that those are CNS depressants. And whenever there's a CNS anti-anxiety like a benzodiazepine, you don't want to mix that with opioids. That's what he's telling us here. And then one of the key words there was pain and swelling. Also, NSAIDs like ibuprofen would be the best choice. Right there. I was complicating myself with other stuff here. I should not have put acetaminophen because that is not for inflammation. So, boom, read the question, circle the main points, understand what he's asking. Um, Here's another question. Laura is 22-year-old female. She has recently undergone a tooth extraction and is in moderate pain. In her records, she has mentioned that she has been drinking 5 or 6 alcoholic beverages a day, several times a week. The only medication Laura is on are birth control pills. What analgesic would you recommend? Why do you recommend that analgesic? Well, when you see alcohol beverages, especially 5, you know, Daniel, that acetaminophen is out of the question. Out of the question. Um, Also, another thing that would be out of the question would be opioids. That shit also will fuck you up. So the only thing I would recommend Laura would be that she take NSAIDs such as ibuprofen. That's it. NSAIDs again, just like before. So NSAIDs See this trend here. Perfect. So that was week one, man. All right, week one. Let's go to the week two check-in quiz. Okay. This is the one that I needed a lot of help in, obviously. Okay. Wow. All right. So week two check-in quiz, boy. Um, more matching crap here. This matching thing is going to be a big amount of the test, according to professor. So making sure that we know what drugs are and what kind of category they fall in is going to be extremely important. So that being said, let's get into this crap here, okay? So I'm gonna go to where I have my drugs, just so we can cross-reference. Most of these drugs are going to be anesthetic related, CNS depressant related, cholinergic depressive related. Okay. Um, not opioid or NSAID related. Okay, okay, okay. So now that we know that, here we go. So he said Paxil. Like, what? That's a brand name, homie. Paxil? You better tell us what the generic name is. Okay. So the generic name for Paxil is Paraxotine, and that is a selective serotonin reuptake inhibitor used to treat depression. Paxil is an SSRI. Haloperidol, okay? Haloperidol, okay? That is a generic name for a first generation antipsychotic. Holy shit. Used to treat psychosis. Haloperidol or Haldol is a first generation antipsychotic to treat psychosis and schizophrenia. Now we have brexiprazole. Okay, that is a second generation antipsychotic. So looks like we have a little trend here is okay, Ols and Pines. Ols and Pines are going to be antipsychotics. Okay. When you think haloperidol, first generation, brexpiprazole, second generation. Clonopin, another one of this bullshit things that where he's just telling us the brand name and not giving us the generic name. Okay. Clonopin is clonazepam, which is a benzodiazepine. Prilocaine is a local anesthetic, which I believe it to be an amide. Isocarboxazid. Okay, here we go with some other bullshit here. Isocarboxacid is a monoamine oxide inhibitor, which is used to treat depression, which that is the generic name for Marplan. Man, isocarboxid, MAOI. Amobarbital, well, we know what that is because of the tall. TAL, unlike Dol, which is a antipsychotic. Amobarbital is a barbiturate. It's barbiturate. There you go. Sarin is a cholinergic because it's sarin gas and it's bad indirect gas. Also part of the ADD thing. Sarin. Okay. Mm. Then he asked, "What is isoprotenerol?" That is a sympathomimetic. Isoprotenerol is a sympathomimetic, and scopolamine is an anticholinergic, also used for motion sickness, if I remember. All right, so here we go. Paxil, SSRI, haloperidol, first generation antipsychotic, brexpiprazole, second generation antipsychotic, clonopin, benzodiazepine, temazepam, benzodiazepine. Prilocaine, local anesthetic. Isocarboxacid, MAOI. Amobarbital, barbiturate. Sarin, cholinergic. Isoprotenolol, sympathomimetic. Scopolamine, anticholinergic. Okay, here we go with some other crap here. Match the mechanism of action with its most accurate class of drug. Not all drug classes will be used. Each drug class can only be used once. So, for inhibiting voltage gated sodium channels, that was local anesthetics. Local anesthetics. Now, for unknown, perhaps destabilizes cell membrane of neuron, preventing action potentials, that's going to be general anesthetics. For prevents degradation of serotonin and norepinephrine, that's MAOIs, antidepressants. Then binds to adrenergic receptors and activates. Those are sympathomimetics. Okay, fight or flight. Adrenergic. When you see the word adrenergic, think adrenals, think sympathomimetics, think fight or flight. So that's a sympathomimetic. All right, a patient has an infection that causes interstitial fluid to be more alkaline than normal. What effect do you think this would have on the effectiveness of local anesthetic? The correct answer is that it'll increase the effectiveness. Okay, if it was more acidic, it would decrease the effectiveness, but because it's more alkaline, the local anesthetic, it would increase its effectiveness. Okay, I was thinking of free base and salt. Free base is more alkaline. Let's see, salt is a hydrochloride, so it would have to be a free base local anesthetic, whatever. This is the way that the professor wants to ask us questions. So in a question like this, interstitial fluid more alkaline, increase effectiveness with local anesthetic. Local anesthetics are never used systemically in the field of medicine. Systemically are never used. The correct answer is false. I thought that was true. I thought local anesthetic. Oh, it's saying that local anesthetics are never used systemically in the field of medicine. I guess that that's false because they do, apparently, according to him. So the question should say local anesthetics are used systemically in medicine. Well, okay then, bro. Thank you for telling me that. Systemically, local anesthetics, sure. Let's see. Did I write anything about that? Let's see. Mm. Hmm. General anesthesia can cause systemic effects. What kind of that mean? Okay. It says here anesthetics turn off the nervous system and usually have no systemic effects. But this dude is saying that local anesthetics that are never used systemically in the field of medicine as false. So meaning that he's implying that local anesthetics are used systemically. All right. So you see that on the test, Daniel, you're going to answer false to the statement that local anesthetics are never used systemically in the field of medicine because according to the professor, they are. Whatever, moving forward. What are ester-based local anesthetics? Where are ester-based local anesthetics metabolized? We should know that in the plasma and the blood. Unlike the amides, which is the liver. Which of these is not a trait of an ideal anesthetic? Systemic reactions. Which of these is not an ideal trait of an ideal anesthetic? Systemic reactions. Jeez. You have given a patient a local anesthetic. They mentioned that they can't feel the vibrations of the polisher. What does this tell you about the dose of local anesthetic you gave them? The dose was too high. Another one, there is no risk regarding use of local anesthetics during pregnancy. That's false. Yes, there is a risk. Which of these is unlikely to cause an allergic response? Which of these is unlikely to cause an allergic response? The answer is amides. Amides are the safest to use. Okay. Which of the following is not a common dental cartridge per ADA standards? That's going to be lidocaine with 1 to 25,000. Just whoa. The issue with vasoconstrictors is that they may provoke serious cardiovascular effects. The dental hygienist is expected to be able to use isoflurane to place patients under general anesthesia. That's false. What stage of anesthesia is best described by failure to breathe without a ventilator? That's stage 4. Which general anesthetic has hallucinogenic effects? That's ketamine. Is the is the drug in the previous question suitable for maintenance alone? No. At regular doses, does nitrous cause loss of consciousness? At regular doses, nitrous oxide causes loss of consciousness. That's false. Which of these is a contraindication to nitrous oxide? That's going to be a cold. What drug would be used alone for maintenance during a major medical procedure? Assume it's a long procedure. That's going to be the fluorines. Indirect cholinergics bind to enzymes that break down acetylcholine. That's going to be true. Acetylcholine esterase. Because remember, indirect acetylcholine esterase. That's esterase is breakdown of acetylcholine. For which of the following should you carefully monitor patients as they stand up from the exam chair? Cholinergics, right? And if I remember correctly, cholinergics are sympathomimetics and SLUD. And that's because, no, parasympathomimetics are cholinergics. Because that's why, because they're relaxing too much. Which of these is a common side effect of an anticholinergic? Increased sweating. There we go. See? Anticholinergics, that's basically fight or flight. So get up, start sweating. What is a common use for anticholinergics? And that answer is for pupil dilation of eye exams. Which of these drugs is used to constrict blood vessels? It's going to be phenylephrine. When you hear blood vessels constrict, you want to look for epinephrine somewhere there. Which of the following is a common side effect of pseudoephedrine or Sudafed? That's anxiety. Wow. Which of the following is a contraindication for isoproterenol? And the correct answer is hyperthyroidism. That's a contraindication for isoproterenol. Regular use of benzodiazepines creates a tolerance. That's true. Which of the following is contraindicated with benzodiazepines? Alcohol. All right. Which of the following is true regarding both benzodiazepines and barbiturates? They are both addictive. Non-benzodiazepine receptor hypnotics are indicated for long-term insomnia in patients. The correct answer is true because those are going to be the three non-benzodiazepine uh, non-benzodiazepine receptor hypnotics. Receptor huh, are treatment for long-term insomnia. Well, what kind of fucking drugs are those, man? Um, let's see. Let's see. Non-benzodiazepine receptor hypnotics and receptor agonists. If it's a non-benzodiazepine This dude made a mistake right here because that just doesn't even sound right. Non-benzodiazepine receptor hypnotics. So boost bar. Hmm. Hmm. We're gonna have to keep this guy on check. We're going to have to keep this dude on check. Are indicated. So boost par. What? We're gonna find out, man. Whatever. The answer to this question is non-benzodiazepine receptor hypnotics are indicated for long-term insomnia treatment. The correct answer is true. Hypnotics. Hypnotics. Shit. Fuck, he's combining two different things. Non-benzodiazepine non-barbiturates and non-benzodiazepine benzodiazepine agonists. So fucking weird. Anyways, let's continue. Which of the following is the primary drug used to treat bipolar disorder? That's lithium. Which of these is which of these is part of the extrapyramidal effects? That's muscle spasms. Antipsychotics may be rotated frequently until the correct medication and dosage is found. That's true. Second generation antipsychotics do not exhibit extrapyramidal effects. That's false because they do, just like the first ones, if I'm not mistaken. Yes. SSRIs generally have mild side effects such as nausea, headache, and diarrhea. That's true. MAOIs are prescribed as first-line treatments of anxiety. That's a false. Those are what MAOIs are antidepressants and they're old and they're not used for anxiety. TCAs, tricyclic antidepressants, are known for interacting with numerous foods. That's false because that's MAOIs. MRIs are known for interacting with numerous foods. Many CNS can be used to treat a variety of psychiatric disorders. Many CNS what can be used? CNS depressants? Is that what he's asking? I'm gonna catch him with that one too. Depressants. That's gonna be true. Okay. A variety of psychiatric disorders, many CNS depressants, I'm assuming. Here we go. You have a 5 milliliter of 10% lidocaine solution. How many milligrams does lidocaine are contained in a cartridge? So what we do is, let's see if we remember this. Come on, Daniel, remember this shit, boy. Remember this shit, boy. So you want to convert the um, percentage from a decimal and multiply by 1,000. So what we did there was that, let's see, so 10% divided by 100 equals 0.1. Okay, times 1,000 equals 100, and then it's 5 millimeters, so that's times 5. Yep, 500. That's how many milligrams of lidocaine in there. So remember, whenever you get a question about how many milligrams of the lidocaine solution, you have to convert the percentage into decimal format and then multiply that by 1,000 and then multiply that by the number of milligrams to get the milligrams of lidocaine. Then we have a question here. You have 2.5 milliliters of a 1 to 400,000 solution of epinephrine. How many milligrams of epinephrine in there? Now, if I remember correctly, we're going to divide 1,000 by 40,000, and that's going to equal 0.025. And then we're going to multiply that by the number of milliliters, 2.5 times 2.5. Yeah, that is the correct answer. So a little bit more simpler when finding epinephrine. So you get this the ratio 1 to whatever, 2 to whatever. This is 1 to 40,000. Just make sure you divide 1,000 to whatever that is. So that's 1,000 to 40,000, and your answer times 2.5. That's the milligrams. Okay, with epinephrine. It says here from the previous question, how many cartridges can a cardiac patient have? The answer to that is 0.64. I'm going to get into that later, maybe tomorrow morning. All right, Daniel, that was the review of both check-in quizzes for week 1 and 2. Hopefully, this helps you ace tomorrow's fucking exam. Get some rest.